19 and its impact on those aged between 0 and 19 years old. As you know, grade 7s and 12s are scheduled to return to school tomorrow. So we thought we'd invite Professor Refiloe Masekela onto the program to shed some light on these issues. She is the head of the Department of Paediatrics at the University of KwaZulu-Natal. Professor, a very good morning to you. Welcome to the agenda.
Good morning, Blaine. Thanks for having me on your show.
It's a great pleasure to have your insight, especially at this time, because some learners, as you know, are heading back to school soon. Many parents are anxious, some are vexed. This, like I guess any other novel virus, is so difficult to understand. Some children are more medically fragile than others. They have these underlying conditions. Having said that, what do you say to a parent who asks you, as a medical professional, how can I keep myself or my child safe in the midst of a pandemic?
Okay, thanks, Blaine. I think, firstly, I would like to really reassure the parents that if we look at COVID-19 and its impact in terms of the number of people in the population that are infected, from studies all over the world, in North America, Europe, China, where the disease began, pediatric patients, that's all young children under the age of 19, they really make a small proportion of infections. It's usually below 6%. Right. If you look at all the studies worldwide. So children are actually not the people in the population that would have the highest burden of disease. So we know from a number of studies now that we've had over the last 5 to 6 months, because this is a novel virus, that unlike other viruses, coronavirus seems to affect children less than all the other viruses that we're familiar with.
Right.
So I think from that perspective, parents should be reassured that from a child's perspective, children are, if they do actually get coronavirus, they usually have an asymptomatic course. That is, they don't actually have any symptoms at all. We just pick them up if we test them because they have a contact. And secondly, children, if they actually do contract the virus, they have a very, very mild disease. They have a very good outcome. Unlike in adults, children who do contract the virus actually do very well. They have a very mild symptom, a very mild course of disease, and they do well.
I want to talk a bit about that. I want to talk a bit about the spectrum of severity with regards to children, because 5 to 6 months ago, Professor, many of us didn't even know COVID existed. I mean, we are learning more and more every day about the deleterious effects of this disease. Parents, as you know, want clear understanding about current COVID-19 transmission and the severity of the virus in children. Do scientists themselves have a clear understanding about COVID 5 months down the line? What have we learned with regards to the spectrum of severity in children?
Well, what we've learned is that only 1% of children. So if you look in total, for example, if you have 100,000 people that are infected, you will have less than 6% of those being children, so about 600. And of those, only about 1% would be admitted to hospital. Of children. And that very small minority of children, that 1%, they actually have a very good outcome. And we think that it's also because children don't have those risk factors that adults have of having heart disease, pre-existing hypertension, renal disease, diabetes mellitus, etc. So even if children get ill, it's either asymptomatic, mild, or even if they do get admitted to hospital, it's actually a fairly good outcome. So children actually do very well if they do get admitted to hospital. So I think that should really put parents at rest, because we know that for the pediatric population, COVID infection is not such a dramatic or severe disease as we're seeing in adults. But of course, you did mention children with other morbidities, other diseases. So those children who probably have severe suppression of their immune system, those children that have severe asthma. And I'm saying this because for those children who have mild or moderate asthma that have not required to go to a hospital or clinic for the last year, that are doing fairly well and they're well controlled on their medication, those children should go to school. Children who have other chronic lung diseases should also probably not go back to school. Children who are on drugs that suppress their immune system, who have heart diseases and severe neurological problems. Those children then are just a subset that I think should be sheltered and protected during this uncertain time.
What do we know? And I keep on hearing about this, especially in the United States, this multisystematic or multisystem inflammatory syndrome, something they describe, which is Kawasaki-like disease. What have we learned about this?
Okay, so what is actually quite unusual about this multi-system inflammatory syndrome, we think that it's probably not Kawasaki. Because firstly, Kawasaki is very common in the Eastern populations, and when the COVID started in the East, and they actually did not even identify any pediatric cases of this multi-inflammatory syndrome. So it looks like it's actually a reaction post-infection with COVID. So it doesn't happen in the acute phase where you would know that after a few days of getting infected with the virus, you'd be ill. It seems to be a post-inflammatory syndrome. And it happens in a small proportion of children that they present with this quite significant condition related to a hyper-stimulation of the immune system or shock. But also, again, it's a very rare complication. We need to remember that this is not something that happens very commonly, and it's actually quite rare. It's a rare complication.
Right. We're entering winter. Children are sneezing more. Their noses are leaking more. How do we differentiate as a parent when you're about to send your child to school whether this is just a flu or common cold symptoms, or it's COVID? What are some of the common and uncommon symptoms that parents need to be aware of with regards to COVID-19?
Well, this is, I think we're in an unfortunate situation that we're going to have two viruses circulation in our population at the same time. So it's very difficult to distinguish the normal influenza from COVID, because you can have a fever, you can have a coughing, you can have the tiredness, which are the common symptoms. But in children, they can also get diarrhea. And what is also quite typical, and it's found in about 45% of cases of children, is they may also have a red or sore throat. So I think my message to any parent, which is usually a normal message that we give to any parent, should child for any reasons, they shouldn't go back to school, because there's then a chance, whether it's influenza or coronavirus, they should not be have the ability to then infect other people in the environment. So a fever, sore throat, coughing, diarrhea and vomiting, and also a sore throat, those are typical. You can find that as well with influenza. So I think for those reasons, any child who's not well should really be staying at home and should not then go to school.
I think that's clear. Thank you very much indeed for that, Professor. What can we learn from other countries when we are dealing with this disease? I was just looking at this report the other day about Sweden, which reports that they kept bars and salons and restaurants open to achieve what's called herd immunity. And they're talking about, apparently, about 7% of the population in Stockholm achieved this. But I understand, you can correct me if I'm wrong, you need about 70% of a population to achieve herd immunity. What's your thoughts with regards to this?
Well, I mean, I think there's despairing views around scientists, but I mean, if they tried to achieve herd immunity, I think that experiment was spectacularly unsuccessful. So I don't think that they managed to achieve the herd immunity that they were looking for. But I think that one of the messages around Sweden is that they also kept their schools open. So the school-going children kept on going to school during the pandemic. Now, if going back to school was going to create these huge clusters and areas where children would be infecting their teachers and each other, in Sweden, this hasn't seemed to be the case. So I think although the herd immunity aspect of the experiment may have failed, but we do then also have some evidence that keeping children in school is probably not going to create new hubs of infection, because this hasn't really happened in the Swedish experience. But of course, we have to take that into context, because Sweden is a much more well-resourced country as opposed to a country. The dynamics in terms of the two countries are completely different. So I think from a sociological perspective, we can see that the risk may be low, but obviously we have a slightly different dynamics in our population.
Right. You know, Professor, scientists have been trying to develop a vaccine for HIV for decades now. We don't have one yet. But in terms of the trials that are currently underway with COVID and the levels of neutralizing antibodies found, how does it compare with HIV vaccine trials?
Well, I think one of the sad things about HIV is it's a very smart virus. So despite a number of years and a number of researchers trying to find the magic bullet, that hasn't been very successful. But I think we need to remember that SARS-CoV-2 is a respiratory virus. We have had the first SARS-CoV-1, well, we'll call it one, but it wasn't called COVID-1. So there has been some work that happened with the first outbreak where they tried to develop the vaccine. So I think in terms of respiratory viruses, for example, we have the yearly influenza virus, because of the huge impact in terms of the infectiousness of the virus, there's been a lot more work done in terms of these respiratory viruses, because as you can see, now we are in a pandemic, which is exactly what epidemiologists and researchers are always concerned about, because these viruses can easily be transmitted between individuals and between countries. And we are at the moment in a pandemic which has affected almost 6 million people worldwide.
It's so important, Professor, for the public to understand how this virus actually works, so they can better equip themselves and prepare themselves in order to fight this virus. Apparently, I learned the other day that we touch our face on an average more than 20 times every hour. That's another concern, especially when you're dealing with children. Why shouldn't we be touching our face now more than ever? Talk to us about how this virus spreads when you touch your eyes, nose, and mouth.
Okay, so I think what I will just say in summary is this virus is actually spread by by respiratory secretions. So when we talk, when we sing, when we anything that has to do with your mouth, where there will be droplets that will be produced, then the virus is then in those secretions, and it can be transmitted to the next individual. So the secretions can either drop down, and they can go onto surfaces, and that's why we're quite concerned about cleaning surfaces. And if the individual is within a meter or a meter and a half of you, then the droplets can then go and be, they can drop onto the individual's face. And if they go into their eye or their nose or their mouth, the nose, the person will get infected with the virus. So why we're saying that you shouldn't be touching your face is because then there's a chance that you can put those droplets of the virus either in your eyes or in your nose, and then you will get infected. So that's why it is absolutely critical that we should all, number one, wear masks. The masks that we're all wearing, the cloth masks, are really to protect your secretions from then going from your face into the next person's, or also dropping down to the ground and infecting surfaces. So it's critical. Our masks are there to protect other people. So wearing a mask is actually a way for us to protect each other from the virus. And it's very difficult to not touch your face. And that's why it's important that when you have your mask on your face, it should be applied properly so that you don't have to continuously maneuver and move the mask around. And every time before you adjust your mask, you should either spray your hands or wash your hands, because there's a chance that those secretions from the next person would be on the outside of your mask. So it's quite critical that whenever you do anything on your face, you want to scratch your nose, scratch your ears, remember, spray your hands or wash your hands, which is the ideal. If you can do so, wash your hand with soap and water for 20 seconds to get rid of the virus so that you don't then get the virus to infect you.
So this virus is spread via these respiratory droplets. What do we know about how long it hangs in the air? Because I was just watching a report where some scientists in the United States believe that what they call 6 feet, we say, what, 1.5, 2 meters or so distance, that might not be enough in terms of how long this virus stays in the air or hangs in the air. What are we learning with regards to that? Is 2 meters enough in terms of physical distancing?
In a normal context, it should be sufficient. Yeah. But there's other things that make the droplets stay in the air much longer and be a little bit more efficient. For example, if you know that the amount of air that you're generating is also going to impact the amount of droplets that you produce. Yeah. So there is some data showing that, for example, if people are doing exercise, if they're jogging or they're cycling or whatever it is, and I see a lot of people do not want to wear the mask when they do that, that actually generates fine droplets which can actually stay in the air and actually travel for much longer distances than the actual 2 meters. So it's also quite critical that people should know about that, and they should not, when they're exercising, not wear their mask, because that's actually when they're the most dangerous for the next individual.
Is the virus found in perspiration, for instance?
No.
No, it's just respiratory.
The virus is just from respiratory secretions, not in your perspiration, no.
Right. So I guess it goes back to your point about the wearing of masks as an important tool in stopping the spread. What do you say to someone who says, why should I wear this mask? It is so uncomfortable. You watch one of the most famous men in the world, the President of the United States, Donald J. Trump, not wearing a mask. Does it really help? I'm too pretty for a mask. This face here, it's too cute for a mask. What do you say to somebody like that?
Okay, I'll say that you're very pretty. But, the issue about the mask is if half of the population wears the mask and the other half doesn't, then the intervention is not going to be successful. Yeah. We, as a community, as a society, have to realize that whatever we do actually impacts other people. Although as an individual you may be healthy, you may be pretty, you may feel that you don't want to destroy your makeup, but there's a chance that you can go and infect another vulnerable individual, and you can be responsible for that person becoming infected and dying. Because we know that a lot of people who have COVID-19 may not have symptoms when they're spreading the virus. So I think at a population level, we should all think about our communities, our neighbors, our friends. And if you're talking to your friend and you have your mask below your nose, that's not very helpful, because the reason why we're wearing masks is to protect each other. So if we don't do that, then we will not win in the fight against COVID.
Yeah, it goes back to the point that our health is interlinked, our lives are interlinked at this time. And I guess Ben Franklin had a point when he said an ounce of prevention is worth a pound of cure. Professor, you've been a great help. We appreciate your time, making the time for the viewers, breaking down the science so we all have a better understanding about COVID. We thank you. Stay safe. Be well.
Well, thank you very much, Blaine. Much appreciated.
All right. Professor Refiloe Masekela, the head of the Department of Paediatrics at the University of KwaZulu-Natal.